flexion of the hip. You don't need to do that, I just need them to know, because it's uncomfortable. You can relax them. Thank you. So with that in mind, what might be a functional movement I want to encourage?
Flexion of the hip.
Flexion of the hip, flexion of the knee, let's do both of those. I'm just gonna take you passively, bring your knee up to about 90 degrees. Nice and solid biomechanics. Supported. Great. Gently checking the movement. Obviously, if there's contractures involved, there's going to be a different presentation, so I'm gonna do what I can. It's encouraging what I can do and trying to pair it with what is fully functional. I'm gonna do this maybe 3 times. We like 3 times. You okay?
Yeah, my hip
Snapping
just
hip?
cracks, it's fine.
Yeah. Can talk about psoas release for a second at some point, but snapping hip normally happens when you extend. That way.
Or just get up and walk.
That'll happen too, yeah. Lower back pain. Nope.
Okay.
Sorry.
It's okay.
I sometimes freak patients out when I'm like, oh,
No, I'm
are you
used
a
to
tennis
it.
player? They're like,
This-
oh, yeah.
This entire
Okay,
program has
this
just
is
showed
like-
me everything that's screwed up with my
Right?
body, so.
Body awareness is just so unpleasantly humbling.
Mhm.
So, done that a few times passively. Hey, let's get you ingrained. Let's do some whole body integration. I want you to look at this leg while I do that. Okay? Perfect. And I want you to think about that motion while you look at the leg. Imagine that you are doing this. And it sounds stupid, right? It sounds stupid unless the person can't do this, right? If they can't do it, then you're basically saying, make your brain pretend it can. Because then you're gonna be pretending it can while you're doing that movement, and it's going to create some stimulus in that manner, right?
Mind over matter.
Mind over matter. Brain is an
Very good.
incredibly powerful thing.
So I just got poked.
Was it actually hard? Yeah, okay, well, friends are great. So, how can we do this with patient doing the activation themselves? Say they're a little bit more functional.
Same thing you did.
Je te laisse là.
Hey, bring your knees 90 degrees.
Oh.
Okay. Good. And back down. Obviously, there's a lot more ab contraction than some people might be able to do. Just drag your heels as you bring your knees up so your feet are on the table. Just let them relax. Great. That's as simple as it needs to be. Right? The more complex, the more detailed, the more fine detailed I can get into. You're not going to be tested on like stage 7, where it's like, cool, you're basically fully functional, we want to get you back to that 5%. But you think of it more in the sense of like pro athletes, where it's like, great, you are needing that 1%, that 30 seconds quicker, that 10 seconds more of like explosive endurance. How can we get that for you? That fine detail is not a lot of the times what we are focused on, because a lot of the times that's the end of the project, right? And at that point, you'll have developed this whole entire thing because you've been working with the patient for a while. We want you to know about the basics so that you know how to address it when it is in the more severe stages. Does that make sense? Does that understand how you would maybe adapt that into a more advanced like recovery phase where they have more function?